Welcome to today's educational video. My name is Dr. Nick here at Preferred Physical Therapy, where we help people 40 plus design a plan to stay active and independent, live free from painkillers, and avoid surgery. And today we're talking about carpal tunnel. A lot of people now working from home, working at computers, doing some things that might be a little bit different, and they're noticing they might get some carpal tunnel like symptoms. Today I want to talk about what the carpal tunnel is, why it affects the hand and wrist area, and what are some simple things you can do to try and remedy this condition. So the first thing is what it is. I've got an image here that I want to show because the carpal tunnel is a tunnel in the front of the wrist. So in this picture, you can see that we're looking at the, this is the palm, this is the front of the wrist, and it is a tunnel where 9 tendons, two per finger to the finger flexors. There's two that will come all the way to the end, and two that will come, or sorry, one that comes all the way to the end, and then one that comes just to the middle segment of the fingers to bend, one that comes up into the thumb to help the thumb to move. And then the most important structure, the reason why we have all this pain is because we have this median nerve. And the median nerve is this main highway that goes down from the neck all the way into the finger to give us some sensation, some feeling into our fingertips. It kind of wraps around the front, leaves the pinky out of it. It is half of this ring finger, and then it comes kind of around, so it's more palm, but also does some motor function. And so why does it get so painful is because, well, we get sustained or repeated compression to the front of the hand. And you can see where the tunnel is formed by this bridge of connective tissue called the flexor retinaculum. And I'll go into what a retinaculum is, but it bridges the carpal bones, or the kind of the bag of rocks that form our wrist bones, from one side and then bridges to the other. And underneath that structure, that retinaculum, is where all these will go. And so there's a lot of movement because these tendons, like strings, are pulling these fingers, allowing them to move. Same with the thumb. And then that nerve is coming in. And as it's moving, rather as we get added compression and we're moving, whether that's from resting our hands or bending our hands into awkward positions and having to move our fingers, we get a lot of friction, a lot of rubbing, a lot of irritation. That can cause some additional tissue growth, much like a callus on our skin grows. That also happens around bones and around tendons. They can get a little bit more fibrous. And as they get more fibrous, that takes up more and more space, and that can irritate or rub and cause injury to the nerve. It can be reversed. It is very reversible, very treatable without surgery. And the way we do that is we look at what is originally causing the issue. We try and get rid of that. So if we're having a lot of compression, and often it's compression, maybe a little bit more extension, bad wrist postures at a keyboard or at our workstation. It can also happen if we're getting a lot of forced flexion with finger bend, any of those extremes. We try and mitigate that. So then if we have a pad at our computer desk, we try and move it back a little bit so it's not so high up into the wrist. We try and keep your wrist at a more neutral or comfortable position so that we can still have as much room as possible in that canal or tunnel for those flexor tendons to slide and glide without irritating that nerve. And then we also do some nerve stretches or nerve glides to increase blood flow, allow healing to occur at that nerve while not overstraining it, while not causing more problems. But you'll know you have carpal tunnel when you're getting pain, kind of this, it can be itchy, burning, or stinging type pain through the fingers. Uh, Difficult to grip things. Maybe you grip and it's like a sharp, like stabby kind of pain. Maybe you're dropping things because that pain will come on very quickly and it's very uncomfortable. Those are things that you'll know you're starting to get some carpal tunnel type symptoms. Or if you're having, at work or you're doing activities and you're starting to get more and more ache or feeling like your hand is falling asleep, that also happens. We also get people who will have this kind of condition because of the way they sleep. If they're side sleepers, which is great, but then they'll curl up as they're side sleeping, and their curl up and their wrist is in a sustained flexed position. They can get carpal tunnel here. They can also get lateral epicondylitis from those sleeping postures or positions when they're too extreme or extended over long periods of time. Anyway, I hope that helps understanding and breaking down what is carpal tunnel, what are the structures involved in it, and how to treat it, and hopefully how to avoid it. It is very, very possible to do so without surgery. If they do go surgery, they just come in, they'll cut the skin, they'll just snip that flexor retinaculum and give it more space. Where that does become a problem is then we have scar tissue, and scar tissue will come in, try and heal the area that's been damaged, though intentionally, and then we can get more compromised space there, um, and then it can happen again. So it is one of those where we want to treat it as conservatively as possible, meaning without surgery, even without injections, because injections to the area, as we know, with repeated use of injections, can break down tissue, can cause additional damage, and that's something that we would want to avoid. A conservative treatment plan would look like a few visits a week over a couple of weeks to massage tight areas, stretch and loosen up tense tendons or joints that are now in a contraction or a less mobile state. And so we try and free up that mobility as well as bring back strengthening exercises. A lot of times we'll lose grip strength or make it very uncomfortable. So we try and get a program in place that will improve grip strength. All these things to help you better identify, better recover without surgery from carpal tunnel. Hope it helps. If you have any questions, feel free to drop them below or give us a call, and we'll be glad to help you out. Have a great day.